Hello and welcome to today's webinar. Today we are going to be discussing how to prepare your practice for the future of healthcare. My name is Caitlin Hausman. I'm the Marketing and Communications Manager at Revell. I'll be your webinar organizer today. Joining me, I have my colleagues Leslie Stewart, Medical Coding Manager and CPC here at Revell, and Tiffany Richardson, one of our certified eClinicalWorks trainers. Few housekeeping items before we get started. If you have questions, use the Q&A box on the right side of your screen. We will have time at the end to get to those. And then second, we get this question all the time. We will be recording the webinar. We'll send that out along with the slides later today. Since we're talking about preparing your practice for the future of healthcare, the key topic today is really telehealth. To start us out, Leslie's going to be talking about the evolution of telehealth, kind of all those changes that we've experienced over the past couple of months, covering telehealth documentation, medical coding, and then diving into maybe what the future of telehealth and reimbursement might look like. Then we're going to transition the webinar over to Tiffany, and Tiffany's going to spotlight some of the new features in eClinicalWorks that are going to help practices with telehealth. So Leslie, I'm going to hand it over to you now, and you can get us started.
Hi, thanks, Caitlin. So one of the questions we have today is there a future in telehealth? So we want to talk a little bit about the evolution and then how we got here. So first, prior to the COVID-19 pandemic, there were a lot of restrictions for both the commercial payers and Medicare. Now, one of those restrictions was the originating site. So our patients had to be residing in a rural health area or in a county outside the metropolitan areas. And also, some of our practitioners were not eligible to provide telehealth services, as well as the billing and payment. So coverage and reimbursement policies, payers did not recognize telehealth services, or the reimbursement was very, very low. And again, limited billable services. As we know, prior to the pandemic, Medicare did not recognize the audio-only telephone encounters. And because Medicare did not recognize those non-billable services, the commercial payers who followed Medicare guidelines also did not allow those telephone encounter to be billable services. So the pandemic hit and CMS broadened access to Medicare telehealth services. The Coronavirus Appropriations Act was enacted, as well as the Section 1135 waiver. So that reduced a lot of the restrictions on telehealth billable services. Telehealth services are now accessible in any healthcare facility, including a physician's office, hospital, and that's inpatient or outpatient, nursing homes, rural health clinics, and even the patient's home. And these enactments allowed for additional billing services, and one of those was the audio-only telephone encounter. And during that pandemic period, in the very beginning, it became very apparent that our elderly population either did not have access to internet or were not able to connect to that audio-visual platform. And so in April, the very beginning of April, the government allowed for those non-audio services to be billable. We talk about the future of telehealth. The most recent announcement related to telehealth being just last week, the president signed an executive order expanding access to telehealth services for 57 million Americans in undeserved rural areas. He also directed the Department of Health and Human Services to cut regulatory burdens and develop a new payment module that allows rural providers to waive some existing Medicare rules and ensure more predictable financial payments. Now, prior to the pandemic, we are very familiar with the reimbursement for telehealth services. I've seen payments as low as $15. During the pandemic, because of the waivers, now these telephone encounter services are being paid at the non-facility rates. So that's helping our providers recoup some of that loss in the very beginning with telehealth services. Next, we're going to talk about the benefits of telehealth. As we look forward, it's important to keep in mind that telehealth may feel like a burden at times, but it offers benefits to patients and to your practice, especially now as we continue to work towards minimizing the spread of COVID-19. So cost. Telemedicine can reduce healthcare costs by up to 27% for those who pay medical care. Telehealth makes getting care easier for patients and collaboration easier for care teams. I had a doctor tell me the other day that he loves telehealth and that he feels he's really providing top quality care to his patients using these televisit services. And again, the convenience. Telehealth is convenient for patients, offers and provides you with a competitive advantage. So telemedicine, again, can reduce healthcare costs by up to 27% for those who pay for medical care. It can do so because it provides care in a less expensive setting. So think about your overhead costs. There are no facility charges, no emergency room specialist charges, or expensive office visits. Next, let's talk about avoiding an audit. That's a scary word, right? And the OIG, I guarantee, will have telehealth on their radar in the next, in the future here. So we want to realize that some remote visits are not telehealth. We want to be sure we're following payer rules, and we want to conduct our own internal audits. So we want to be familiar with those payer rules specifically, because even though Medicare says they allow certain services, that payer may not still recognize the audio only visit or even the televisit with audio and visual. Again, let's review some of the specifics for CPT billing coding guidelines for telehealth. As we know, telehealth communications is a two-way, real-time, interactive communication between a patient and a physician or practitioner at a distant site through telecommunications equipment that includes, at a minimum, audio and visual equipment. Telehealth services substitute for that in-person encounter. This is a non-face-to-face encounter with your patient. So just a brief review of those telehealth virtual check-ins and e-visits. So audio only is our telephone encounter where our patients are unable to connect to an app such as Zoom or using your ECW Healow. Those patients who are able to connect to an app such as Zoom, the billable services are your E&M series codes, your 99201 through 99215. Now remember, because of this pandemic, we're allowed to see new patients. That virtual check-in, that G2012, that's that brief 5 to 10 minute phone call. That's a check-in to determine if you need further services. And if not, then you're still allowed to bill for that brief check-in. Again, because of the pandemic and those restrictions are removed, we can see new or established patients. Our e-visits, that's where your patient is connecting to the patient portal in your practice management system. 99421, 99422, and 23 are your billable codes, as well as your G codes for those non-physician practitioners who treat that patient. Documentation is key. The coders rule, if it's not documented, it's not done. So we want to help our providers assure that they are completing the telehealth documentation correctly. And what's nice in most of your EMRs, you can create those fancy little templates and use it as a checklist to make sure that those documentation requirements are met. So first, we want to have the notation in the chart that the patient initiated and consented to the televisit. The providers may contact patients to inform them of the new televisit rules, and upon the patient's consent, the provider can provide health care during that same call. The physician needs to document the type of platform he or she is using. So whether it's audio visual, if it's audio only, if it's the patient portal, or if it's that brief encounter. names of all people present during a telehealth visit and their role. So say that you're having a televisit call with a patient who resides in a nursing home and needs a nursing assistant. You'll want to document that in your note. As with all notes, chief complaints, the history, your assessment, your plan of care, and then the total time spent for that telehealth visit service. We have to remember, patient portal is a time-based code, and your audio-only CPT codes are time-based. So in order to select the correct CPT code, the time is very important. And we want to be familiar with our payer guidelines. Here at Rewell, we are very conscious of those payer guidelines. You know, Medicare, your primary payers, commercial plans, United Healthcare, Blue Cross Blue Shield, each have their own specific guidelines. Medicare requires place of service 11. In some states, Blue Cross Blue Shield still requires that place of service 2. But we want to make sure we're collecting the non-facility rate. So that place of service is very important. If we're billing with place of service 2, you know, Medicare may pay you at that telehealth rate versus the non-facility rate for place of service 11. What payer requires modifier 95? What payers require the modifier CS for cost sharing? Being familiar with your payers is very, very important. And we want to align your revenue cycle management with the evolving telehealth. You want to evaluate how telehealth impacts the patient experience, how easy it is for online appointment scheduling. It's a paperless process. And then is the patient utilizing the patient portal and messenger within the data sets? We want to ensure appropriate and accurate documentation. Do you have someone dedicated in your office to oversee the telehealth changes, again, as it relates to payers and payer-specific guidelines? You want to conduct internal audits. Are we documenting the platform and assigning the correct CPT code based on the platform? And are we following up on the payments? Are we receiving the non-facility rate versus the telehealth rates? And then, as always, continue providing education and training for those ever-changing guidelines. Upgrade your RCM for maximum benefits. So analyze claim follow-up processes to reduce denials. Again, we want to submit clean claims. Maintain strong communication with the payers, and fully optimize the practice management systems for automation to reduce errors. So if we know a specific payer is only going to recognize 99212 through 99214 series for their audio-only visit, it's always smart to set up those rules within your EMR, so at the time of claims creation, we eliminate that error and submit that clean claim. And then we want to analyze the telehealth operations. What technology is being used? Are you using the telehealth consent form? And what type of service is being provided? So again, your platform, your telehealth visit, your virtual check-ins, or is it an e-visit or audio-only visit? And how are time-based encounters captured? Are you documenting the time spent for that call, for that visit? Again, how are you coding for place of service? So what is your payer requesting? Place of service 2, place of service 11, or as Medicare stated, treat it as if you were seeing a patient in a nursing home, then you would bill with the nursing home place of service. If you would normally treat that patient in home, then bill with that place of service 12. Again, rules are changing daily. Who's monitoring those telehealth changes? And how are the providers being educated on these changes? Let's talk a little bit about your internal audits. We want to make sure we're collecting correct payment and submitting correct CPT codes and ICD-10 codes. So step 1, recommending you review your payer guidelines, reference effective dates, and determine what changes to be made based on the payer specifics. We developed a payer list for all payers, and in that payer list, we've included, what platforms are billable services. We've included what place of service that they want to be used, and as well as what modifiers are required. So you'll determine the telehealth platform based on the documentation CPT code assigned. So I recommend going back to those March claims, those early claims, because Medicare did not acknowledge the telephone encounter until April. So some of those claims in March had been billed with the incorrect CPT code. So we want to make sure we add those corrections and get paid at the right non-facility rates. And then again, does documentation support medical necessity? You'll recall too in April that a new ICD-10 code was established for the COVID-19 diagnosis. Is the place of service correct? 02 versus 11. Medicare and some of the major payers recognize that the place of service is equal to what would have been had the service been furnished in person. So again, in the nursing home, in the office, or hospital setting. And is your modifier correct? For those carriers who are waiving copays, you want to make sure that CS modifier is appended to those COVID-related symptoms and testing. And then step 3, if there's not any mismatches, you want to review your payment report and determine if the claim was paid at the non-facility rate. Determine if the payer will automatically reprocess or a corrected claim submission is required. Is there a future in telehealth? I believe there is. Some telehealth policies may become permanent. Permanent expansion of the originating sites to include all geographic locations, including the patient's home. So one, eliminating that originating site only to be reflective of that rural area. Allowing any healthcare provider to provide telehealth services if they can bill Medicare for face-to-face services. There is a need to provide better internet access to rural, underserved, and low-income communities, and to continue coverage of telephone only, no video services to help serve these patients. So again, internet access is not available. We want to encourage the payers to allow us to continue billing the audio-only telehealth service. Removing any in-person requirements of certain services for check-in or renewal of care, home dialysis, hospice. Permanent removal of frequency limitations for services where temporary restrictions have been lifted. These benefits have been made clear that there is a future for telehealth. We've heard a lot about how payers are becoming more flexible with reimbursement policies surrounding telehealth, and many restrictions are being lifted or will likely be lifted in the near future. The future of telemedicine continues. The brief check-in via telephone or other telecommunications device. Again, remember this is to determine if an office visit is required, or you can continue the exam using your telehealth service. E-visits, this is the patient and provider communication through the online patient portal. So are your patients logging on to their portal? And then telehealth, the patient and provider two-way conferencing for real-time consultation. And then one of the things we want to talk about is remote patient monitoring. This is a new service that we will really looking into, seeing if this is an advantage for our clients to create extra revenue. And as of March 1st, CMS is making it clear that clinicians can provide remote patient monitoring services to patients with acute and chronic conditions and can be provided for patients with only one disease. For example, remote patient monitoring can be used to monitor a patient's oxygen saturation levels using pulse oximetry. While some clinics have successfully started providing RPM services, a majority still struggle to understand the complexities of this type of care and the reimbursement guidelines. This is something to keep on your radar and will certainly be on ours as we move forward and look at how telehealth changes care delivery post-COVID.
Great, thanks, Leslie. Tiffany, I think you've got a few things here on some new features in telehealth, if you want to talk to us a little bit more about that.
Yes, absolutely. Thanks, Caitlin. Some of the features that we have come across with Telehealth Solutions is not just the televisit itself, but there's some other areas that we would like to review. So eClinicalWorks has many solutions for providing care with televisits, Hello to Healow, and online appointment booking. A quick review of eClinicalWorks Telehealth Solutions that separate this product from other competitors is the ability to provide an up-to-date patient-provided data. This helps to prevent documentation errors and reduce staff time with data entry as an added bonus. Healow allows the patient to click "I have arrived" on their smartphone, letting the practice know they have arrived at the office and where and how to find them. With ECW Telehealth Solutions, the check-in process has been streamlined to allow patients to review their demographics, confirm their insurance coverage, sign consent forms, fill out questionnaires, and review their medications, allergies, hospitalizations, and surgical histories. We have reviewed Televisit capabilities in greater length during previous webinars. Our focus today will be the new Televisit features, or those that will be released in version 11.50. All options will still require a patient to be web-enabled by providing an email address. Some of the new features to come in the new version update is screen sharing. With screen sharing, providers can enhance their patients' understanding by reviewing the results and medications together, discussing their health history, and sharing health education materials. Another new feature with the version 11.50 update will be joining a televisit using a 12-digit code. It's a unique code that is automatically generated when the televisit appointment is created. This allows the patient to join a televisit much like they do on the patient portal, but instead of logging in or downloading the information from the portal, they would be able to log into the televisit using an email, a text message, or by the app. Practices can currently initiate a visit with text message or email. By sending a text or an email link to the patient, letting them know it's time for the visit. The patient would not be required to download or log in to the patient portal, but it still requires that they become web-enabled by providing an email address. But it's just another option so that the patients don't have to log into the portal and go through that process. Text and SMS logs may be reviewed to ensure the patient successfully received their reminders by reviewing the text logs when the reminders are sent out. And eClinical Touch now has televisit functionality. It provides a user-friendly experience for providers to conduct a televisit easily from their iPad without all the hassles of conducting compatibility checks, but also to keep in mind with the time that we're in where we're cleansing and disinfecting, it's a little easier to disinfect an iPad than it is a laptop. Last, another feature that's already available in usage is the usage analytics. Users can track the number, the type, and the duration of calls, as well as patients' ages, gender, and other characteristics, promoting more complete and quality care. And I've recently had a question regarding this because the patient stated they never had the visit with the provider. And we were able to look at the analytics logs to see, in fact, that the patient did have that visit, and we were able to prove that. Hello to Healow. Not a brand new feature, but a newer product is Hello to Healow. Hello to Healow provides on-demand video and audio call capabilities. Physicians and other medical providers may reach out to patients without having to schedule an appointment or give out a personal phone number. Much like Televisit, Hello to Healow provides call logs and Healow analytics as well. The last feature now available with Hello to Healow is the mobile app for physicians. Busy medical professionals may use the eClinical mobile app to conduct on-demand audio and visual calls on their smartphone. eClinical Mobile works with both iOS, Apple, and Android phones. Another telehealth option is online appointment booking. Patients can request or book appointments online. while your practice remains in full control of providers' schedules with just a few keystrokes. This is not a new feature, but may prove to be useful in your practice for a more automated online booking experience. Online appointment booking may be used for new or existing patients. The patient confirms with a text message, and the practice has the option to automatically drop the appointment on their schedule, or the practice may review the appointment prior to the appointment being booked. It also requires the patient to document either insurance information or that they are a self-pay. Last, comparing Healow televisits to Healow to Healow. As seen in Healow to Healow, it may be used on 11E, which also is called browser, eClinical mobile, and or eClinical touch. And it has the ability for Healow analytics and call logs are available. It is not available in the older version, the EXE platform. It has to be one of these 3 platforms that it's utilized in. Televisits will require an appointment, and a patient must provide an email. Healow Analytics is available. Capabilities to conduct a televisit without requiring the patient to log in or download the patient portal. Televisit provides free televisit text appointment reminders. It may be booked online. Televisits provides a screen sharing capabilities and is now available on eClinical Touch. Thank you, Caitlin.
Awesome. Thanks, Tiffany, so much. I know over the past couple of weeks, we've definitely seen a lot of updates come out, so it's nice to hear a recap on kind of what's new there. So I want to move forward and make sure we get to any questions. So if you do have questions at this time, please go ahead and put those in your Q&A box on the screen. Big thanks again to Tiffany and Leslie for presenting. While we wait for some of those questions to come in, we do actually have a 3-part webinar series coming up in September where we're going to talk about eClinicalWorks analytics features like safety and compliance dashboard, the provider hub, MIPS dashboard, PM analytics, and I believe even some EBO content. So we're really excited about that. We hope you can join us. We're going to go ahead and look at the questions box, see if we have any come in. All right, so let's see. One of the questions, I have multiple providers that have a hard time getting connected to the patient. It happens at most of our locations. The providers use multiple computers or cell phones and still can't get connected to the patient. It says not on the clinic or patient end, causing them to switch to a different platform. Let's see. My provider is wondering if there is any reimbursement from ECW when this happens. So Tiffany, this actually sounds like a question maybe you could help us with. Have you seen that happen in other scenarios where there have been issues with either the televisits feature or even H2H?
There has been with the televisits feature, mainly in the EXE platform, the older platform, because it doesn't have the plug-in functionality that browser has. So you have to do a manual download of the Healow agent, and there is a little bit more effort that's involved. I have tested eClinical Touch, and it is so smooth and so easy to use. And again, like I'd mentioned before, with the infection and cleansing and such, it makes it easier to clean an iPad than it does a desktop, laptop, or whatever. But browser, because it has the plug-in functionality, it is a lot easier to use than the older platform, the EXE platform.
Okay.
And they've updated as far as the patient side of it. I have tested it with the web enabling. There, you are required to have an email address in the field, but you would not be required to have the patient actually log into the patient portal. So you can send a link to the patient and they can actually open up their televisit right directly from that text message link or from the email link. And I've tested both of them and they work fantastic.
Okay, great. Yeah, I mean, would you recommend here maybe opening a support case to see if eClinicalWorks could help, and then obviously checking to see maybe if the browser version is a better option here?
Yes, definitely. I mean, look at it, eClinical Touch. Again, it's not available on eClinical Mobile, but I would definitely contact support to see if there is some functionality. And we provide training as well if anybody wants training on how to conduct these calls using links rather than um, downloading the patient portal and going into the app.
Okay, great. And it looks like the other question that we had come in was about receiving a recording. We will send out a copy of the presentation, both the recording and the slide deck, and then include that link to the upcoming analytics webinar if any of you are interested in learning more about some of those analytics features. But I'm not really seeing any other questions come in here. I know it was a lot of information. We do have a survey that's going to pop up whenever you exit the webinar, so feel free to send us your questions that way. And obviously leave us some feedback so that we can continue to present on some of the topics that are relevant to your practice. But thanks again to Tiffany and Leslie. Really appreciate you taking time to present today. I know a lot of people really appreciate you sharing your expertise here. To everyone on the line, stay safe. We hope you'll join us in September for our next webinar. And thanks again. Take care, everybody.